Hello, I'm Dr. John Cruz, and today I'm going to be talking about social anxiety disorder and ADHD. I'll be talking for about 20 minutes. If you have questions now or during the talk, you can type them in and I'll try to answer them. This will also be posted on YouTube and Facebook afterwards. And I usually start with the take-home message. So the take-home message is recent studies show about 30 to 40% of those people who have ADHD also have social anxiety disorder. They can be confused together, they can overlap and hide each other. They do seem to be separate biochemical and neuroanatomical problems, as it were, in the brain. And my big message today is we think a lot about how ADHD contributes or causes or may lead to having social anxiety disorders, but I think it would be helpful to also think of social anxiety disorder as an attention problem. So I'll delve into that in a bit. So what is social anxiety disorder? So to begin with, it's not just introversion or shyness. It's not just a temperamental desire to minimize interactions or contacts with others, because many people who are shy or introverted are pretty comfortable with that stance in life. You can be shy and introverted and have social anxiety, and probably there is some linkage there, but there's certainly many extroverted people who do have social anxiety. So social anxiety is characterized by an intense fear of social situations, but particularly of being exposed or scrutinized, or people looking, judging, evaluating you when you're with others. So performance anxiety is considered a subset of social anxiety. So fear of giving speeches, fear of being on a stage, fear of performing in public is again a subset of social anxiety disorder. And one of the most common aspects of social anxiety disorder is actually a fear of showing that you're anxious. So in those situations, so it's sort of a feeding back on itself. You're already anxious, and then you become afraid that what people are picking up on is your very anxiety in that situation, and it's sort of self-justifying because you are anxious, and then you become convinced that everyone's focused on that and judging you harshly because of that. So other aspects of the official definition of social anxiety disorder is the anxiety has to be disproportionate to the situation. So if you're at the Kabul airport and the Taliban are arriving with Kalashnikov rifles and you're feeling anxious, that is socially appropriate to be anxious. So that is not social anxiety disorder. Many people with social anxiety disorder are aware that when they're feeling anxious, freaking out in the line waiting for their latte at the Starbucks, and that people are looking at them, they know that there's some unreality, disproportionate, extreme exaggeration to their worries, but it's hard for them to let go of those worries. Number 3 aspect is that the situation has to usually provoke anxiety or fear. So it's not just a one-off deal where one time you felt anxious when the teacher called on and you weren't ready and you blushed and got, if you can sit in the classroom and not be worrying and not be anxious, other times that isn't social anxiety, it was just a bout of anxiety. Point number 4 is that the anxiety has to be strong enough that it either leads to avoiding certain social situations, or if you are enduring them, you're sort of white-knuckling them. You're enduring them under distress, under discomfort. And point 5, sort of building on that, all of the conditions we put in our DSM-5, which are current nomenclature for mental health diseases, disorders, is that it has to be causing both distress and dysfunction. So you have to be, not just mildly upset, but it has to be distressing to you, and it has to lead to some impairment, that you're either not going to work, or you're avoiding going around the block because you don't want to be seen by people waiting on that street corner, or that it's interfering with normal daily life, so causing dysfunction there. And some other criteria is it has to be continuing for at least 6 months or more. So just a brief, few weeks bout of this does not constitute social anxiety. For some people, social anxiety is just a, several months issue. For others, it is pervasive throughout their life. And the seventh point, good thing I'm not feeling socially anxious right now, flubbing how many fingers I have. Seventh point is that it can't be due to another condition or medication or other reason. So part of the confusion, so again, a couple different studies have suggested that upwards of 30-40% of people with ADD or ADHD meet full criteria for social anxiety disorder, but often the social anxiety disorder is missed, or occasionally, particularly if you're in an anxiety clinic, you may have your ADHD being missed. So there's at least 3 big symptoms that can look similar in the difference. 3 common symptoms of ADHD and social anxiety can look similar from the outside, but are coming from different causes. And again, remember, you can have both. So if you have both, that's coming from a combination of causes. So one is just difficulty socializing. In the ADD, pure ADD situation, difficulty socializing often come from inattentiveness, where you're missing social cues, you're not paying attention, or it could be other aspects of ADHD making you misinterpret social cues, or sustaining friendships or relationships. You're getting off track often enough that social mates don't find you a consistent and attractive person to keep interacting with. Difficulty socializing in social anxiety disorder is sort of the core of social anxiety disorder. It's coming from anxiety, that the person feels worried, judged, uncomfortable in those situations, and that further makes them anxious and flooded during the social interaction, so they either can't do it well when they're in it or are avoiding it, so they're not doing it. Second, common overlapping symptom is inattentiveness. So inattentiveness is a core symptom of ADHD, and in ADHD we understand it as a deficit in the executive function. So it's a core wiring issue that leads people to not be paying attention. Whereas inattentiveness in a pure social anxiety disorder situation, the inattentiveness is coming from the person being so distracted, so worried about how they're coming across or how they think people are perceiving them, that they're not paying attention to what's going on around them. So you could be so anxious about how you're walking across the stage to get your diploma that you walk right off the corner of the stage, or walk right into the person handing diplomas, or you're being inattentive. But again, in that situation, the inattentiveness is a manifestation of your anxiety and worry, which is so distracting to you. And again, there's certainly lots of people with both of these where both may be contributing in a given situation. And then a third common symptom that's cited for both ADHD and social anxiety is not completing tasks. Now again, with ADHD, this is thought to be tied into the core problems with executive function. So someone may get distracted, they're pulled off their task. They may be forgetful, short-term memory deficits or difficulties, so they don't get back on task right away. And troubles with time management and disorganized planning may lead to adopting procrastination as a strategy for managing life, but not getting tasks done, producing tasks. In social anxiety disorder, not completing tasks is largely due to feeling shame and anxiety. So you've started something, but then either you were getting feedback or thought you were getting feedback, or were worried that people were doing it wrong, or even if you started out beautifully, then you're worried that you're going to, next action, next step, next stage is going to be a decrement and will destroy the whole thing because it's not as perfect as you started out at. So again, these are different. You can certainly have only social anxiety, you can certainly have only ADHD, but they two can come together and they can be confused with each other. So why might they show up together? And again, some of the recent studies show that 30 to 40% of children or adults with ADHD do, at least one point in their life, manifest social anxiety disorder, full-blown disorder, whereas in the general population, even though this is one of the most common anxiety disorders, and anxiety disorders themselves are some of the most common psychiatric conditions, the general population rate of social anxiety disorder is only on the 2 to 12% range, so it's substantially higher in ADHD. So the commonest set of explanations, and I'm going to use shorthand that's a little offensive, so I will, and not everyone with ADHD does these, everyone with ADHD doesn't do them all the time, but people with ADHD engage in weird behaviors. I'll get back and explain what I mean by weird behaviors. If you act in a weird way, then you are going to be criticized, you're going to be bullied, you're going to have people making judgmental statements, and particularly if you're kids or you're near too many Trumpist Republicans, you'll be bullied, not just criticized. And that evokes shame in the person who's being attacked, criticized, bullied. Shame then leads to fear and avoidance and withdrawing, and those fear and avoidance and withdrawing behaviors themselves are weird, different from the mainstream, different from how others are responding in that situation, so they evoke further criticism, which leads to further shame, leads to further withdrawal. So there's one model of social anxiety is that there's this socially driven feedback loop. So with ADHD, the behaviors that I labeled loosely and not particularly helpfully as weird are at least 4 sort of core ADHD symptoms. So if you're inattentive, you're going to miss social cues. You're going to not be paying attention when someone's talking to you. You're going to be dropping the ball in a group game or effort. Again, people will pick up on that and then criticize that. So that's an hyperactivity of ADHD can also lead to behavior that's weird or out of the norm. So if you're someone who's always tapping their fingers, or you go in a room and you have to be the one, you get in your friend's car, you're the one touching the buttons, you're rearranging the window, you're leaving the seat back, you're getting in other people's space, you're doing other things that people are perceiving as weird or different and may subject them to bullying or criticize. Impulsivity, another core feature of ADHD, can also lead to weird behavior. So I have patients who come in here and tell me, oh, the last patient who was in here smelled bad, and they'll say that as the patient's, walking down the hallway, or they'll blurt out they hate my garden and they think it's too messy. Other people may have those thoughts, but they don't blurt them out instantly. So again, impulsivity can lead to socially awkward situations, stepping on other people's toes, offending people, and is likely to earn some amount of criticism, judgment, bullying. And maybe the most important one is, again, not everyone, but particularly with the hyperactive forms of ADHD, emotional dysregulation is strongly linked to that. And if you are more likely to explode when someone does something that's mildly triggering, or you do something nice and someone's you have ADHD and you're jumping up and down screaming with enthusiasm, that greater display, that more instantaneous, faster display, that more extreme display of emotions can make others uncomfortable, can make others prone to judge it or assess it or criticize it. Again, leading to that cycle. So there's at least 4 different realms of ADHD-like behavior that can lead to behavior that's different from the norm. So there's a lot of attention on this in ADHD magazines and online talk discussion groups and others, and scientific literature. I think we're missing some of the other side of the connection between ADHD and attention disorders, specifically social anxiety disorder. And I actually view social anxiety disorder as an attention disorder. What? How does that make any sense? So what's really going on in social anxiety disorder? You're trying to wait in line at the ATM, but there's 6 people there and you're worried that everyone's staring at you, so you freak out and leave the line, or you're called on in class and you know the answer, but you're afraid you're not going to say it as quickly as the last person or as smoothly, or you're afraid that your own anxiety is going to trip you up and you just freeze or shut down. What's going on in social anxiety disorder is your focus is on how you're doing something rather than on what you're doing. So you're focused on other people's judgments or your own judgment, your perceptions, you're grading it. So what I've been teaching people is my quest versus test framework. Social anxiety is about viewing all these situations as tests. If you can step back from viewing it as a test and view it as a quest, trying to sort out what am I trying to achieve here, what am I trying to do here, how can I focus that, how can I get into doing rather than evaluating. That's a cognitive framing for getting out of social anxiety disorder. And again, that's why I would label social anxiety disorder as really an attentional problem, because you're focusing on the wrong, unhelpful thing, or even with the excessive worrying weeks in advance about how you're going to do, how well you're going to do, how poorly you're going to do on a certain performance. If you just focus on practicing or doing better, or focus on chilling out and not worrying at all, that's going to be more helpful than focusing on how things can go wrong. So I'm going to go through this pretty quickly. So what are treatments for social anxiety disorder in the setting, particularly of ADHD? Often, if particularly if the anxiety is what's brought to the forefront, or someone's focused more on their anxiety than on their ADD, or more aware of their anxiety, or has been taught to use terms that convey most of their problems, anxiety, there may be big reluctance to using stimulant medication, because stimulants do, in the general population and in anyone, if they get high enough a dose, increase anxiety. But in study after study of people with anxiety disorders, including specifically social anxiety disorders and ADHD, Ritalin, methylphenidate, atomoxetine, Strattera, duloxetine, Cymbalta, all are effective at not just addressing ADHD symptoms from mostly their noradrenergic and dopamine action, but can also lead to decreased anxiety. And the thought is, if you're more focused, if you're more on track, if you're more responsive and accurately listening to your environment and responding to it, things are going to go more smoothly. Again, maybe my model, if you're maybe more able to direct your attention to what matters, which is what you're doing rather than how you're doing it, it's going to go more smoothly. I actually have a strong preference for duloxetine Cymbalta over Strattera or atomoxetine. They both have good norepinephrine reuptake action, which is helpful for ADHD. Duloxetine is also a serotonin reuptake inhibitor and is probably more extensively and substantially helpful for a whole range of anxiety problems. So separate from medications, we know that a whole host of CBT techniques, particularly exposure-based techniques, are helpful for social anxiety. It's essentially taking small enough steps so that you are in your mild discomfort zone but not completely flooded with anxiety, and practicing so you demonstrate that's safe and okay to do, and being kind to yourself so you're not criticizing, beating yourself up for doing it, but learning that and learning to be in touch with your breathing, your body, that you are aware of your sensations but not over-interpreting them as dangerous, damaging things that everyone else is aware of and going to be criticizing you for. So a related, using some of these, maybe a more DBT approach to social anxiety, so this is overlapping, it's not mutually exclusive at all, feels that actually the ability to read and assess and learn about, so your emotions is what's many people with social anxiety disorder need help with. So they need help with identifying what emotion they're really feeling at different times. They need help learning to accept their emotions. They need help to communicate their feelings in maybe more effective ways, or more maybe just communicating at all rather than shutting everything down. And they need help with regulating their emotions. And all of those steps will lead to less social anxiety. So I'm not seeing any questions coming in. I'll give it a few more seconds. Next week's topic is a little maybe more offbeat, and it's whether there's an autoimmune component to ADHD. So be safe, be healthy, and if you have questions later, you can post them either here or on the YouTube channel where this will be recorded later. That's all.